Welcome back to McLaren Port Huron's Today's Health Program. Today we're talking about trauma services, and joining me now is McLaren Port Huron's Trauma Program Coordinator, Kathy Napolitan. Kathy, thank you for joining us today.
Thank you for having me.
Now, McLaren Port Huron is a designated Level 3 trauma center with the state of Michigan. Why is the hospital also pursuing verification on the national level?
Well, continuing with the process improvement and the performance improvement that we are doing with the state, if we're tied into the national organization, the American College of Surgeons, then that is just going to be additional data that not only can we input and give them, but we're also getting back from them so that we can continuously improve the care of our patients here in Port Huron.
Now, to review, what type of injury qualifies as a trauma?
Well, they can go from anything extreme to anything small. So a major motor vehicle accident where someone is knocked unconscious and has broken bones, or it can be that you cut yourself at home trying to clean something that's glass and suddenly you have a bigger cut than you thought. That's a trauma as well.
Now, it sounds like most trauma patients come to the hospital via EMS. How would our viewers know whether or not they should call 911 if they think somebody that they're with is having a trauma?
Well, it would be hard to determine what severity of trauma you might have at home. So if there's any question, always call 911. The advantage to it is that those paramedics and EMTs and that ambulance can already start the process that we do from the American College of Surgeons and the state trauma program. They start the ball rolling already with the type of care that you should have as a trauma patient.
Now, in addition to the emergency center, what other areas of the hospital are involved in the care of a trauma patient?
They really touch almost every area of the hospital, whether it's the floor that they go to, OR where they have surgery, blood bank, lab where they have tests done, radiology, CAT scan, counseling if it's a severe trauma and they have some trouble dealing with the issues that come from that. So it really touches everyone. Pastoral care can be called in, respiratory comes down immediately, our CRNAs respond to the ER. So it touches everyone.
Now, what special training do the staff who are involved in the trauma program receive?
Well, it varies based on where you come into the continuum of care. If you're in the emergency room or you're in the OR or you're in the ICU, then there's a special program called the Trauma Nurse Core course, which all of those RNs take. Now, there's also other programs that we use within the hospital to reach all of our inpatient RN staff, and actually all of our RN staff have had geriatric trauma education. So we have a lot of ways to get it out there, and there's also a program that went to every person that's employed at the hospital that they did regarding trauma centers.
Wow. So as the trauma program coordinator, what are your responsibilities?
Trying to make sure that all gets done.
Sounds like quite a job.
And there are a couple committees that we have to run as part of the performance improvement program. So I run those with Dr. Basania, who's our trauma medical director. But there's also that outreach into the community and also into those other departments within the hospital. So we keep them involved in the trauma program, and then when an issue comes up, we pull them into like a subcommittee so that we can keep those things going. And then there's the data collection, and we have someone, a registrar, who puts all the data in, and then we pull that data back out to help us keep improving our care.
Now, what does being a Level 3 trauma center mean for our patients in our community?
Well, that's one of the best things, I think, when I took this job. It was so interesting to me to be living in the area we do. We have a nice town here, but we have a lot of rural community. And in trauma data, if you look at it, 25% of car accidents occur in the rural areas, but 66% of deaths from car accidents occur in the rural areas. And the biggest reason is the time it takes to get them to a trauma center. So to have a trauma center right here in Port Huron, and so you're not driving 2 or 3 hours from Mackenzie to get all the way down to the city, you can stop here and we do exactly the same steps. We do exactly the same care that they would get in the city. So it really provides better trauma care to our rural community.
Now, what is McLaren Port Huron doing to prevent injuries from trauma in our community?
We do a lot of injury prevention work here locally. So we do some things with the kids. We go out to the schools, and St. Clair Safety Day and the Children's Fun and Fitness Festival that's here at the hospital. And so that's kind of helmets and bicycles and walking and stranger danger. And then we also do elderly fall. We have a new program that really came from the state to start here called Matter of Balance. And so our registrar is a coach for that. And so we offer that to older people in our community. community. And then we also do things with the region. So within the state of Michigan, we are Region 2 North with Oakland and Macomb County, and there's an injury prevention committee. And we were at the 4-H fair last year here in St. Clair County, so all of the injury prevention people from the city, from McLaren and Oakland, came up and they helped us here. So now this year I will go down to Macomb County, it's their turn, and we will have it's actually going to be a geriatric day of safety and all that kind of stuff. So anything that we can do to prevent the injury, that's the best thing. So we're up to a lot of that.
Kathy, this has been great information. Thank you for joining us today.
Thank you for having me.
And thank you for watching. If you have questions, need a physician referral, or have suggestions for topics you'd like to hear more about, you can contact us by calling Health Access at 1-800-228-1484. You can also watch Today's Health, request a copy of our program, and access other reliable healthcare information by visiting our website. As always, tune in next time to Today's Health. Today's Health is brought to you by McLaren Port Huron.